So, about chiropractic care for other specific problems. Most of the time I'm treating musculoskeletal problems, nerve, muscle, joint problems. But if any time along the way there is something going on organically where someone's having stomach problems or cramps or headaches or something that most people don't know chiropractic can help with, a lot of times it can, and it's not that I treat those specific problems. There's not a specific adjustment I do for cramps, but if there is a problem at the vertebral level where those nerves come out and go to those organs, a lot of times it can help with whatever it is. There's a lot of things that respond to that really well. Ear infections are one that most people don't think about a chiropractic adjustment helping with. And I'm not adjusting for an ear infection, I'm just adjusting the neck and it controls that area. And it does really well usually. So a lot of things like that where we can treat more problems than people probably think we can.
Okay, I know that chiropractors and MDs have similar to the same amount of schooling as far as like your coursework and things, but I know that chiropractic even has I have some information about that compares the courses, and that chiropractors actually have more hours of time
in certain areas.
And so what I've been finding is that chiropractic is kind of been doubted as a way to treat more than just a back injury because I got in a car accident. So what do you say to the doubters to help them learn that chiropractic is a new way of life?
Sure. And honestly, how I usually start that is I understand that people doubt sometimes. We all doubt things we're not familiar with. And there was a huge fight between the AMA, the Medical Association, and the ACA, the American Chiropractic Association, that lasted many years. In the 1970s, there was actually a ruling by the Supreme Court that the AMA was trying to bash the ACA, and that they were trying to essentially put the ACA and put chiropractors out of business, saying we weren't educated. Unfortunately, at that time, we were educated, but nothing like we are now. As far as the hours, yes. Now, total hours classroom is actually more for the 4 years of chiropractic school than it is medical doctor. Certain areas like orthopedics, where we're testing joints, and radiology, I mean, we have almost double the hours in those areas. There's a lot of difference in those areas. The place where we differ as far as education, I'll keep going on education for a second, the place where we differ on education is treatment. Most of the treatment side of a medical doctor is pathology, is drug reactions, how those pharmaceuticals affect the body and the toxicology behind it, what that turns into chemistry-wise in the body. We don't use a lot of drugs, so we don't prescribe at all. So on this side, on our treatment side, instead of pharmacology, which we would be studying pills we don't give, we study manual medicine, the myofascial therapy, the adjustment, where we take care of problems mechanically. In between, you have a medical doctor, you have a DC, doctor of chiropractic. In between, you have a DO, who has some training in both. Doctor of osteopathy is what that's called, and the DO originally was very similar to chiropractic, except they started studying the pharmaceuticals also, and they would give drugs sometimes. That's converted in school now too. They don't have much adjusting in school as far as education now. Most of their treatment is now the pharmacology side. So that's the difference, and that's why they're more accepted into the hospitals than a DC right now.
Okay. So
that's the difference in education. But I was trained to do pap smears. I was trained to do every kind of exam. Like, it's not like we miss that in school. We just don't choose to practice that way always. There's doctors of chiropractic that can and do. I don't do
Just like a specialist that's an ear, nose, and throat doctor. They learn about everything, but they specialize in the ear, nose, and throat, and you are a specialist in the spine, which affects the whole body.
Absolutely.
Okay. Because I know that medical doctors refer to other doctors, just like, you know, if it's not their specialty, an endocrinologist isn't going to talk about lupus, they're going to send you to another doctor, a rheumatologist. So
that happens the same way, and it used to be where we didn't have that professional courtesy to refer back and forth, medical doctor to chiropractor, chiropractor to medical doctor. It's no longer like that. The whole time I've been out of school, I mean, I run into medical doctors, don't get me wrong, I run into nurses, I run into a lot of people who are not educated yet about what chiropractic does and really the science behind chiropractic. They're just not familiar with it, and I don't blame them for that. We still run into problems where my patient's told not to come back to me because I might kill them, which makes no sense. But it does happen sometimes still, but 99% of the time, I've run into that a couple times, and like I said, my biggest referral sources are medical doctors now. So everyone who's educated about chiropractic and knows what chiropractic's about, in the big scheme of things, feels comfortable and sends us patients.
And that's what one of the basis of my paper is about, is to find ways to better educate people so that they can take advantage of this other type of treatment.
It's so necessary. Half of what we do is education for our patients. Most patients come in here, and a lot of them are scared to even be here. A lot of them don't know anything about chiropractic. They're just here because nothing else has worked. It's in the next 20 years, I think, you know, over that amount of time, there's going to be a lot of people that come here first because they know that if it's a musculoskeletal problem, that we're the first ones and we're the most educated and we're the first step into that care. And then if it needs a surgery, you know, I can evaluate and do everything, x-rays and everything, and then refer from there. So I think we're going to be more the first stop as this progresses, but right now, you know, it's just not the way it is, and that's okay.
Why do you think that might be linked with why insurance companies don't cover chiropractic care as readily as they do other, even for example, a therapy, an ultrasound therapy covered at a chiropractic office compared to at a physical therapist office?
There's a big difference in coverage. Obviously, professionally for me, this is hard because if it's an ultrasound therapy and I'm doing it compared to a medical doctor, compared to a DO, compared to a doctor of physical therapy, if we're all four doing it, we all get paid 4 different things from the same insurance company, from the same plan, because for some reason across the board there's nothing that aligns it. I think that therapy, no matter who does it, should get paid the same. It's the same therapy, and that's not the case, and I can't tell you why. Honestly, for me, if I was running an insurance company and I could send someone for $1,000 for chiropractic care and save a surgery, or even pay for, you know, if a DO was doing manipulation, put us on the same level and the same treatments were happening here. I'm doing an adjustment and a therapy in my office, and there's $1,000 treatment. That same treatment in a DO's office where he's doing an adjustment for the same therapy could be 4 times.
Same diagnosis codes, same therapy codes.
Everything, but it costs that insurance company more to go that route. So to me, it doesn't make a lot of sense. I mean, and the more insurance companies figure that out, and they have over the last 5-10 years, their coverage is getting more. They're still not paying us well, but they are covering more because they have seen the side of, oh, well, we can save money if they can get better over here without a surgery. That saves us a lot of money. So insurance companies are kind of wising up to that, but it's just not there yet.
Okay. Is there anything else you'd want to add? Considering it's short notice.
Yeah.
Sorry. Okay. Thank you.
You're welcome. Did you want to ask me those other ones?
Oh yeah, the success story, or I can ask them if you want. I just don't want to get too much time because I've already taken a long time.
Yeah, we did that one.
Yeah, we did that one. This is another one that you already answered, so
Okay.
I didn't have to ask that. But
My success story.
what are the?
I have so many.
Yeah, I know.
Every day
What
I
about?
have
Well, we're recording. I'm just going to edit anyways. What are 3 things you wish that everybody knew about chiropractic?
That's a good one.
Or 2 things, whatever. What's something that you really wish that the general public knew about chiropractic? Because of how beneficial it can be, what do you wish they knew? So if I could put on my website information and it could get to these people, what do you want them to know?
What I want them to know. I think 3 things. The biggest 3 things I try to educate my patients about. 1, my malpractice insurance is very low because we don't hurt people. A lot of people are scared of chiropractic because they have heard a horror story, 6 people down the line, somebody got killed or something, and I've never heard a true story like that. So my first thing is chiropractic's not going to hurt you. We're getting joints moving that should be moving, and that's the amount of what we're doing. It just frees up the nervous system. That's the biggest thing, is no injury there. Just want people to be educated about it and know what we're doing and why we're doing it, so that some of the slander stuff stops. And then thirdly, most of the time we can help. 99% of my patients that come in my office, I don't have to refer them out right off the bat. I mean, there is a lot of conditions that we really can truly heal naturally, and people just don't know that. People don't know we can help with carpal tunnel because it's a problem with the nerve. Like, people don't know that we can help with a rolled ankle, a sprained ankle. They don't know that we can prevent that neck surgery, that back surgery. They just don't know that yet. And that's the biggest thing for me, is education-wise, I just wish people were more educated about it.
Okay. And is there an area or field that you're working on, interested in right now? Have you published any articles?
I'm working on research right now with pediatrics. In fact, you'll be getting a little survey to fill out yourself. But yes, we are doing a current research project where we are, and it's a national project done through the ICPA, the International Chiropractic Pediatric Association, and we're gathering a lot of research about just kids in chiropractic care, and preliminary studies have been great. Real next to no side effects at all, and great results with the kids. So my heart's in the pediatrics and the pregnancy, and that's probably where I'll progress and keep studying the most out of anything. But yeah, we are actually working on a study right now in our office. So.
Okay. And on a side note, can you adjust infants?
Absolutely. At 2 hours old is the earliest adjustment I've ever done. I checked my daughter at about 2 minutes old, so she luckily didn't need an adjustment. But yes, from the time they come out, and actually the birthing process can sometimes cause some misalignment there, and we like to check for that. So.
All right. Thank you.
You're welcome.